I'm Dr. Ashwini Behere. I'm a physiotherapist by profession. 8th September is celebrated as World Physiotherapy Day. Today's video is going to be about awareness on physiotherapy. So physiotherapy dates as back as 460 BC. Historical documentation says so. But in India, it was only in 1952 that physiotherapy actually started gaining momentum. The polio outbreak, which crippled a lot of people, physiotherapy actually helped in strengthening the muscles, and gaining movement for those patients. So, even 10-15 years back, where physiotherapy was known as massage, or people were very less aware about what it does. Today, the scene is a little more better than that, but there's still a long way to reach for us. We need to reach a lot of people and help them understand how physiotherapy can help them, treat them, and in what conditions it can be applied. So, this video is going to be based on that. By definition, as the name goes, physiotherapy means treatment by physical means. That means it does not involve surgery or medicines. So it's a branch of medical practice where movement or function of the human body is concerned, and it basically deals with the quality of life. It enhances the quality of life. I always say this: doctors save lives, but physiotherapists make it worth living. Moving on, I'll be talking about what branches are there in physiotherapy. So much like in medical field, the branches are the same in physiotherapy as well. So you have orthopedic, which deals with bones, muscles, ligaments, tendons. You have pediatric, which deals with small children, neurological, which is to do with brain and spinal cord and nerves. Then you have oncology, which is another branch which is specific to cancer patients and cancer survivors or post-cancer treatment. Gynecology or women's health, it also forms a very important branch. Sports, as you see nowadays, because India is emerging into sports, physiotherapy in sports has also gained a lot of scope. Then there are several other branches. Cardiorespiratory is one of them. COVID outbreak and pandemic, people are now aware of how important it is to have the physiotherapy in cardiorespiratory conditions. Most people have been put off oxygenation and oxygen cylinder, and their lung capacity has improved only because of physiotherapy. There are a lot of conditions in which physiotherapy can be applied. The list is exhaustive, and trying to explain each of them is beyond the scope of this video, but I'll try to mention most of the names here. So you have Parkinson's disease, there is paralysis, you have peripheral neuropathies, neck pain or cervical spondylitis, shoulder pain, frozen shoulder, rotator cuff tears, any ligament or tendon injuries, carpal tunnel syndrome, tennis elbow, Bell's palsy. Then you have any gynecological related issues with pre or post pregnancy dysmenorrhea, menopausal issues, lower back pain, slip disc, sciatica, arthritis of the knee, arthritis of the lower back or lumbar spondylitis. You have arch issues, that is flat feet, or you have ankle sprains, and there are many other conditions in which physiotherapy can be applied. Physiotherapy becomes in fact the first line of treatment. Other conditions like cerebral palsy, bowed legs or knock knees, then heel pain, vertigo, balance issues in elderly, cardiorespiratory conditions, post cardiac surgeries or post respiratory illnesses, all the viral conditions including COVID. You will find a lot of physiotherapy being done in these conditions. Now, broadly, you will see physiotherapists in two settings: in inpatient or in the hospital during the stay in the hospital, and outpatient or clinical basis. During your first session, which is mostly the consultation, your detailed evaluation will be done. So your symptoms will be noted, history will be taken, your medical history will be understood and noted. And a main important part is the physical examination, where we do certain tests and we understand what part is affected, how much it is affected, whether there is swelling, how much the muscle strength is, whether there is stiffness, tightness, and all these things. This helps us in coming to a diagnosis if it is not already done, or it helps us in understanding the prognosis, which means whether how long this condition will take to recover, or whether it can be cured fully or partially. And so basically, then understanding about the condition and explanation of this same would be given to you in the first session. Based on this first session, the rehabilitation or the treatment will be determined, and this is a little long durated process, physiotherapy, but it also depends on each condition to condition. And as the patient starts improving or showing more independent level, we start reducing the number of sessions. Contrary to what people think, physiotherapy doesn't require a referral from anyone. So you can directly consult a physiotherapist for any of your issues. If we require the need to cross refer you to some of the specialist doctors, then we can do so. We can also order for MRIs, X-rays or blood work if we think that is required to be done. The best part of physiotherapy treatment is that there are no known side effects in this therapy, and it can also coexist with your other treatments. So if you're taking any alternative therapies, Ayurvedic treatment, homeopathic treatment, acupuncture, or if you're on allopathic medicines also, still you can continue taking physiotherapy. Another benefit of physiotherapy, which I think what makes it unique and long term, is that you are participating in your own therapy. So basically, physiotherapy is an passive and active form of treatment. So the active part is where you are involved in your therapy, and that's why it becomes more long term. I hope with this video now you have a better idea about what physiotherapy is and how it can help you. So next time you have any issue, I would say do not hesitate to consult a physiotherapist. We may be able to help you get better. Thank you so much.